And welcome back to the Morning Blend. Birth control can do more than its name. This morning, we're going through other reasons a woman may want to take birth control and both short-term and long-term options. Here with more is Dr. Christine, and she's an OBGYN at Well Health Women's Specialty Care. Good morning, doctor.
Hi, thank you for having me.
Thank you for coming in. So many women take hormonal birth control for one reason, right? And that is to prevent pregnancy. But I have a lot of friends personally who have been taking it since we were early teens because of acne or because of an irregular menstrual cycle. What are some other reasons why people would take birth control?
Yeah, so like you said, some women might take it for treatment of acne.
Okay.
Some women might have more body or facial hair than others, and it helps with that as well. It helps treat painful periods, heavy periods, PMS, which is like a premenstrual syndrome with the mood swings and all that before your period, as well as PMDD, which is a more severe form of PMS.
Okay. Okay. And at what age do women start taking birth control? In most cases.
Yes. So a lot of women start taking birth control in their teen years when they have some menstrual irregularities, like irregular periods, heavy periods. But there are a lot of women that start it when they start having sex as well.
Okay.
Yeah.
And when
so it's very variable.
It varies, obviously, for each woman, each situation. When a woman gets off birth control, how soon can they get pregnant? Say it's a time in their life where they want to start having children.
Yeah. A woman can get pregnant right after.
Immediately?
She can ovulate 2 weeks after and get pregnant immediately. For some women, it might take a couple of cycles. And then, depending on the birth control, it might take a year or two before they can have children, but that is usually one specific kind of birth control that does that.
Okay. Okay, let's take a look at what we have here on the table. Start with you, your side.
So on my side, I have some more long-term contraception options, birth control options.
Okay.
The first one is the implant. It's a little small implant that is true to size, and it gets implanted in the woman's arm. It is good for up to 3 years, and it's excellent birth control. The most common problem women have with this is irregular bleeding.
Okay.
The other,
It's not what it'll do.
No. The other long-term birth control option that we have is the IUD, the intrauterine device.
Okay.
We have a hormonal option and a non-hormonal option. Non-hormonal option has copper in it. It's good for up to 10 years. And then hormonal option, there's a 3-year one and a 5-year one.
Okay.
The benefit of the one with hormones is it can help treat heavy periods. About 20 to 25% of women will stop getting their periods with the hormonal option, and the rest of them will have a huge decrease in their bleeding. And
Sounds like a nice option.
Yeah, it's excellent. And then the non-hormonal is good for women that have reasons why they cannot have hormones.
Okay. Okay. And then the shot is another option, correct?
Yes. This is the Depo-Provera shot. This is the one that you take every 3 months in your doctor's office. Excellent birth control. A huge proportion of women will stop getting their periods with this. Some of them might have some light spotting. This is the one that may delay your periods afterwards when you stop taking it, and may delay your ovulation for up to a couple of years. So I usually caution women about that.
Okay. Would you consider this long-term, short-term, and can you describe the difference in the two?
I would say it's more of a short-term. The long-term, the long-term ones tend to be, the shortest long-term one is 3 years. So it's like 3 years and above for the long-term birth control methods.
So once the IUD, which one more time that stands for?
Intrauterine device.
Okay, once the IUD is inserted in you, it's up to 3 years. It is effective,
Right,
correct?
at least 3 years.
At
Then
least
we have
3
a 5-year
years.
one and a 10-year one.
And tenure. Okay. So over here, some more short-term products, correct?
Yes. So this is the NuvaRing. Just the white part, not the blue.
It's not the whole thing.
No.
Don't get scared.
And this is inserted vaginally by the woman, and it stays in for anywhere from 3 to 3.5 weeks. And then you just swap it out after that. Excellent birth control. You just have to be comfortable inserting and removing. And in a small percentage of women, it may come out on its own, but it's easy to just put back in.
Okay, so it does not dissolve. This is you have
Correct.
to
It just secretes
take it.
hormones, and it has estrogen and progesterone in it as well.
How often do the hormones, you said it's...
It's kind of a steady amount every day.
Okay, every day. All right.
And then this is probably the most common.
Time and time again.
This is the most common one. The birth control pills. Everyone knows about these. You take them every day. You want to take them about the same time every day. We have two kinds. One has estrogen and progesterone. The other kind has just progesterone in it. Kind of depending on your medical history and other things, we decide which one is better for you.
Okay.
The downside is you have to remember to take it every day. So it's more more dependent on how well you take it as how well it works.
Yeah, set those alarms. I know
Exactly.
friends who have to do all kinds of things.
Yes,
Sticky
absolutely.
notes on the mirror.
Put it by your toothbrush, set an alarm, just kind of put it in a normal part of your routine every day.
Right.
Yeah.
Okay. And the last thing is the patch.
Yes, so we have a patch, which I think we have a picture of.
There we go.
It is placed on your arm, and it's a weekly patch. And then after 3 weeks of weekly patches, then you take a week off to get your period at that point.
Okay.
A few women may have a reaction to the adhesive. Other than that, it's really good birth control.
Okay, and the patch that we saw in the photo was on the woman's the hip area, so it can go on the arm or the hip.
I think usually it's the hip or the butt.
Okay.
If you want to leave it to exposed areas, it might, it might come off and stuff like that.
And questions. You don't want questions. Well, thank you so much for your time and for educating me on an IUD. If you have questions about birth control options, contact Well Health Women's Specialty Care. They have multiple locations throughout the Valley. To find out more, just call the number or head to the website you see right there on your screen. They are also on Facebook and Twitter. And